Let's take you back to KwaZulu-Natal, because mop-up operations are underway in places where rampant looting and destruction of infrastructure took place. But even as some are trying to deal with the aftermath of the damage, looting is still happening at places like Umlazi mega city shopping center in that province. Our senior reporter Aviwe Mtila is in Umlazi township to check the current situation, and he joins us now. Aviwe, you have moved to Umlazi. What are you observing there?
Well, I'm visiting the hospitals around KwaZulu-Natal. Of course, they haven't been spared the brunt of what's been happening. In fact, as those riots have been ongoing, some hospitals are reported to have been working on skeleton staff. And in fact, while the roads were closed and the burning of cars happening in and around KwaZulu-Natal, some of the staff, hospital staff, has been reportedly sleeping in the hospital. Now, just to get a clearer picture of what's been going on, I am joined by the MEC of Health in KwaZulu-Natal. Mama, thank you for joining us at eNCA, but maybe paint a picture, because we hear it was even difficult to access oxygen for some of the hospitals. What's been going on?
No, thank you very much. We've not really had a serious challenge with oxygens, but we are going to run short in the next couple of days if the situation doesn't change and if Afrox is not given an opportunity to replenish. Fortunately, we've been engaging with the security cluster, and it has been agreed that they are going to be escorted into our facilities. So the issue of oxygen for now is not a serious concern. However, we really have been worried in the last 24 hours because we've realized that in eThekwini and Umgungundlovu in particular, there are facilities that have been under threat. And this facility in particular, Mahatma Gandhi, is, although the facility itself was not attacked, there were attempts at trying to get into the facility. But the biggest challenge around this hospital is the access. Our staff or health workers are unable to access the facility. Even patients that have been inside or that was admitted, or patients that were admitted, have not been able to leave. As you could see when we were here with you, we have had to arrange transport ourselves to get the patients who have been discharged to go home. And of those that we have arranged to take home, there's about 7 newborn babies that have been waiting for the past hour or so while we were trying to get transport for them. So the challenges in this facility right now are quite many, and they come from different angles. So we have been struggling in Mahatma Gandhi with staffing in particular because the staff can't access our facilities. What we've decided to do, though, is to arrange transport for our staff to be able to come to work, and those that are going home, we are trying to take them home and provide self-passage for them. We've also engaged, or we are in the process of engaging the military in terms of getting the health workers from their part to come and assist us, and we believe the minister has signed our letter that will go to the Minister of Defense, and we are waiting for that particular process. Of course, our engagement with the military is not just for the health workers, it's also for the military to guard some of our facilities, because we believe that there has been some attempts, not that we believe, we know there has been attempts in other facilities, attempts that were actually successful. This is the second facility that I'm visiting today. The first one was at Klengeni, where we started Psych Hospital, and when we got there, we realized that there were people who came into the facility and they took 18 of our computers that are in that particular facility, and just one block, everything that is electronical was wiped off. Now, we don't understand what that means, and we do not believe that can have anything to do with any legitimate cause. We just think that people who went into our facility are people who are opportunists and people who are hooligans, and they found an opportunity to get in, steal our equipment, and be able to sell the equipment, and we believe that's what that is meant to do.
So lootings of hospitals as well. But MEC, I want to touch on the issue of the reported deaths in KwaZulu-Natal, over 60 from last night. Have you been accessing, just around the difficulty of accessing those bodies and retrieving them? How has it been, given that the lootings have been ongoing?
eThekwini in particular is hardest hit in terms of those that have passed on and bodies that are on the road and in other sites where there have been skirmishes. We have found it to be quite difficult to get to those bodies. As a result, we had to engage the SAPS to accompany some of our forensic pathology services motor vehicles so that we are able to go and pick up the bodies. But we've also had to extend an invitation to the private people to come and assist us, those that are running mortuaries and those that have businesses to come and assist us in picking up those bodies. That is how we've been able to pick up and, try and manage the best we can. It's not been a problem in other districts as such, but at eThekwini it is extremely hard. And it's very traumatizing to the families to see your loved ones sleeping there for more than 12 hours just because the vehicles cannot get through. It really is a problem.
I can imagine even the vaccination drive must have been impacted by the ongoing lootings we've seen. What's the situation there, and how soon can we see it back up and on track?
Well, our vaccination drive, really, you are correct, it has been affected in a sense that we have primary sites and we have secondary sites. Our primary sites are all our hospitals, but the vaccination in the hospitals is continuing. Of course, that depends on whether the health worker that is supposed to provide the vaccine has been able to come into the site. However, we've not stopped that and it is continuing. But in the secondary sites, and here we are talking about the halls, the areas that we had to go and open sites just to vaccinate our people, that has suffered because you really can't go to a community hall under these circumstances and vaccinate people and bring out old people because you can't guarantee their safety. So it really has suffered. However, yesterday we had opened 44 vaccination sites and some in the whole province now, and they continue to vaccinate. Even in other districts, they still continue to vaccinate. The hardest hit community sites are here in eThekwini, Umgungundlovu, King and probably Lembe, because those four are the hardest districts when it comes to the Department of Health in particular.
Okay, thank you very much. The MEC of Health in KwaZulu-Natal in the Mahatma Gandhi Memorial Hospital, just detailing some of the challenges they've had to face as the hospitals have not been spared in the ongoing lootings that the province has faced.